Welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, I'll be looking at the pelvic outlets. I've done a lecture on the pelvic inlet. If you've not checked that lecture, please kindly go and do so. But for the purpose of this class, we'll be focusing on the pelvic outlets. Let's try and use this image here for illustration. This is the inferior view of the pelvic cavity. And at this region here that is carved out in white is where we have the pelvic outlet. In this lecture, we'll be looking at the different structures that are seen to form the alignment of the pelvic outlet. And we'll also be looking at the differences between the male and the female pelvic outlets. So the pelvic outlet, we say it is the inferior limit of the true pelvic. If you try to use this image up here for illustration, this is the pelvic bone. And within the pelvic bone, we have a space that is referred to as a pelvic cavity. And this pelvic cavity is further subdivided into two at this level here that is carved out in dotted red. And this is what is referred to as the pelvic brim. This pelvic brim is seen to subdivide the entire pelvic space into the greater pelvis, and this is what is harrowed here in yellow. This is the greater pelvis because it is this region of the pelvic that is located above the pelvic brim. This is also referred to as the first pelvis. While inferior to the pelvic brim, we have the true pelvis or the lesser pelvis. And this is the lesser pelvis because it is the region of the pelvic cavity that is seen to be located inferior to the pelvic brim. So this is how the entire pelvic space is further subdivided into the greater pelvis up and the lesser pelvis below. So inferiorly, the lesser pelvis is limited by the pelvic outlet. And this is what is carved out or demarcated here in white. So we say that the pelvic outlet is the inferior opening or aperture of the true pelvis. This pelvic outlet has its diamond-shaped configuration. So if you try to use this image down here, this is the entire space here that is carved out or demarcated in white. So this is the opening that is created at the inferior part of the true pelvis. We already know by now where the true pelvis is located. So this space is not just left opened, it is seen to be padded up or closed up by the pelvic floor. And the pelvic floor is a collection of muscles that are seen to form the inferior limit of the true pelvis. And this is what is seen here to be demarcated in blue. So you have a number of muscles, coming together to pad up or close up this space that is created. And this pelvic floor, which we say is a collection of muscle, is not seen to completely close up this aperture, which is the pelvic outlet. It is seen with hiatuses, which are holes created around the pelvic floor. So we have the urogenital hiatus at the front here, and this is what is demarcated here in white. Urogenital, from mere breaking down the name, as I've always said on this channel, is to allow for the passage of the urinary organ and also the genital organ. So within this space, we have the vaginal canal and also the urethra gaining access to pass through this channel. Because the urethra and also the vaginal canal are located within the true pelvis, and they need to exit this space through this hiatus that is created on the pelvic floor. It is through this channel that they are able to release their content out of the body. Then if you go more posteriorly, we have the rectal hiatus. This rectal hiatus is what is seen to be demarcated here also in white. This rectal hiatus is seen to allow for the passage of the anal canal. We know that the rectum is located within the true pelvis, and inferiorly it becomes continuous as the anal canal. This anal canal is seen to finally terminate as the anus, and at this point is seen to allow for the passage of physics, which of course will also be needed to be released out of the body. So if these hiatuses are not created, this structure will not be able to exit the pelvic cavity, and it is through this opening that they are also able to release their contents out of the body. So we now see the essence why a complete closage is not seen at this point, why these hiatuses are also needed to allow for the release of the contents of these organs out of the body. So going further, let's look at the outline of this pelvic outlet. We say that this pelvic outlet has an almost diamond configuration outline. So because it does this, we are going to be following also this pattern to establish the different structures that are located at different points. So if you look at this image by the side, this is the anterior view, and behind here we have the posterior view. We say it's always good for us to place these organs in anatomical positions. So by the time we start highlighting the structures that are located at specific points, it will be easy for us to understand. And we know that in this anterior part here is where we have the pubic symphysis, while posteriorly we have the coccyx. If you go at the more anterior part here, we know that this is where we say we have the pubic symphysis. This is where the body of the pubic bone are seen to connect together. And at this point, they are seen to form a joint that is referred to as the pubic symphysis. So at this anterior part, we have the inferior border of the pubic symphysis, and this is what is seen to be harrowed here in yellow. It is the inferior border of the pubic symphysis that is seen to align with the pelvic outlet. If we go back to our lecture on the pelvic inlet, remember when we tried to establish the configuration of the pelvic inlet, we stated that it is the upper border of the pubic symphysis that is seen to contribute to the alignment of the pelvic inlet, and this is of course understandable. So for the pelvic outlet, which is at the inferior part, it is the inferior border of the pubic symphysis that is seen to contribute to this alignment, and this contribution is seen at the anterior midline region. So if you go more laterally, because we say this is the anterior side, this is the anterior view, and this is the posterior view. So if you go more laterally, we are going to be having the anterior lateral border of this diamond shape configuration. Because if we say it is diamond shape, it means it will be having the anterior lateral border and also the posterior lateral border. So for the anterior lateral border, we have the pubic arch, and this is what is seen to be highlighted here in red. You can see that this is on the anterior side, and of course it is on the lateral side. So the anterior lateral border of the pelvic outlet will be formed by the pubic arch. This can also be referred to as the ischiopubic ramus. This pubic arch, we know that it is an inferior extension from the body of the pubic bone. Remember that the body of the pubic bone is seen to contribute to the formation of the pubic symphysis at this point here that is harrowed here in yellow. And we have superior extension from the body of the pubic bone and inferior extension. So it is the inferior extension, which of course will be forming the pubic arch that also forms alignment with the pelvic outlet. And this is what is demarcated here in red. Then the next structure that you see is the ischial tuberosity. This is the ischial tuberosity here. This is referred to as the tuberosity of the ischium, and this is seen to form the alignment of the pelvic outlet. And this specifically, this alignment is formed at the lateral edge of this diamond shape configuration. Then the next region that we'll be going to is the posterior lateral border of this diamond shape configuration, and this is formed by the sacrotuberous ligament, and this is the sacrotuberous ligament here, harrowed in black. Just from mere breaking down the name, as I've always said on this channel, we would be able to establish the structures that are involved in the formation of this structure. So for the sacrotuberous ligament, it is the ligament that is seen to extend from the tuberosity of the ischium to the sacrum. So this is the sacrotuberous ligament. And we know that we have the sacrospinous ligament is also located around the space, but the sacrospinous ligament is located deeper to the sacrotuberous ligament. And this is why the sacrotuberous ligament is what is seen to form the alignment at this region. And the next structure will then be the posterior midline structure of this diamond shape configuration. And this is formed by the tip of the coccyx. And this is where we have the tip of the coccyx. So we know that this is a one-sided alignment that is formed. This kind of pattern will also be formed on the other side, form a complete diamond shape outline. So if you go to the other side, the next structure that we'll be seeing is the sacrotuberous ligament, and this is what is seen to be arrowed here in black. This sacrotuberous ligament is of the other side. Then this is followed with the ischial tuberosity that is harrowed here. And finally, we have the anterior lateral border that will be formed by the pubic arch, which is highlighted here in red. You can see that now we have a complete formation of this diamond shape outline. So if we try to create that diamond shape outline at this region here that is highlighted in blue, and also trying to establish the different specific structures that are seen to align with this diamond configuration at specific regions. If you look at the anterior midline region, it's where we say we have the inferior border of the pubic symphysis, and this is what is harrowed here in yellow. At the anterolateral border here, we have the pubic arch. And if you go more laterally, at the lateral edge, you have the ischial tuberosity that is arrowed here in green. If you go more posterior laterally, the structure that we see is the sacrotuberous ligament. And this is what is seen to be highlighted here in black. If you go more posteriorly, at the posterior median region, at this edge here that is pointed, is where we have the tip of the coccyx. And if you go on this other side, the same alignment that is formed here will also be seen on this other side. So at this posterior lateral region, you also have the sacrotuberous ligament, and at this lateral edge, you have the ischial tuberosity, and this is followed with the anterolateral region, which will be formed by the pubic hack. So this is how this configuration runs, forming a diamond-shaped configuration. So it is important for us to be able to highlight the specific structures that are seen at different points. So let's use this slide to describe the differences between the male and the female pelvic outlet. The pelvic outlet is wider in females, and this wideness is created as a result of some modifications that are seen around the pelvic outlet. So let's try and describe the reason behind this wideness. The pubic hack is one of the reasons behind this. If you go to this image up here, this is where we have the body of the pubic bone here, highlighted in yellow. We say that the body of the pubic bone, we have a superior extension and an inferior extension. So this is where we have the superior extension here harrowed in black and the inferior extension here harrowed in red. It is this inferior extension that is seen to form an arc-like configuration around the pelvic outlet, and this is what is highlighted here in dotted red. So you see this arc-like configuration, but in female pelvic specifically, this angulature is seen to be wider, and this will lead to the creation of more space around the pelvic outlet. So to give further explanation, let's try and use this image down here for a more detailed illustration. This is where we have the inferior rami of the pubic bone. Remember, this inferior rami is what is responsible for the formation of the pubic hack, because we have one on this side and we have another one on the other side. The inferior rami of the pubic bone is seen to form this arc-like configuration, and this is what is referred to as the pubic hack. So if this pubic hack is wider, it means that the acetabulum, of course, will also be spread wider apart. So you have a wider acetabulum in the female pelvis when compared with the male pelvis. This is because of the extension or expansion that is created by the pubic hack. Because as it increases in terms of its expansion, it's also going to be pushing the acetabulum also more wider apart. And this is the kind of presentation that you see in the female pelvis. And because of this wideness, you're also going to be seeing the ischial tuberosity that is already at this point also more wider apart. So if a region at this frontier is wide, it's also going to be pushing the ischial tuberosity also to be more wider apart. You also be having the sacrotuberous ligament also that is harrowed here in green. We have two, one on this side and one on the other side, will also be pushed wider apart. And if you look at these structures that we have listed, they are structures that are seen to form the alignment of the pelvic outlet. So because there is an increase in the angulature of the pubic hack, this is also going to be pushing other structural components around the pelvic outlet also more wider apart. And as this occurs, it's going to be creating a more expanded pelvic outlet. And this is why we say that the pelvic outlet is seen to be wider in female than in male. And this is needed because during birth process, the head of the baby will need to be able to access the pelvic outlet, because it is through this channel that the baby is finally released or delivered out of the body. So it needs to be wider in female than in male because of the birth process. Let's look at the applied anatomy. The pelvic outlet is also one of the regions that is used for evaluation during pelvimetry. So a number of evaluations are measured at the specific point around the pelvic outlet to also determine whether the head of the baby can pass through the pelvic cavity during vaginal birth. So we have anterior-posterior dimension, and this is what is harrowed here in black. And this is specifically measuring the distance between the inferior border of the pubic symphysis to the tip of the coccyx. We also have another form of anterior-posterior dimension that could also be measured. This is what is also represented here in black. And at this point, the distance between the inferior border of the pubic symphysis to the sacrum is measured. We also have the transverse measurement, where the intertuberous circumference diameter is taken, which is the distance or the space that is created between one ischial tuberosity to the other. And this is what is seen to be harrowed here in yellow. We also have the interspinous diameter, which is the measurement between one spinous process of the ischium to the other spinous process on the other side. And this is what is also seen to be harrowed here at this point. So we have different points within the pelvic outlet that can also be used to evaluate measurement during pelvimetry. And this is basically to determine whether the head of the baby can pass through this space during vaginal birth. So thanks for watching this video.